Good afternoon, everyone. I hope you've been enjoying the conference so far. While we're getting started, feel free to introduce yourself in the chat. You can share your name, your pronouns if you'd like, where you're joining from. And since this crowd seems pretty food motivated, feel free to share your favorite version of mac and cheese or some other food dish that you enjoy more than mac and cheese if you're not a fan of mac and cheese. So I'm sure you're all excited to hear from our closing keynote speaker, Senator Reverend Raphael Warnock. But before we hear from him, I'm so excited to announce our Health Justice of the Year Award. After a year as grueling as 2021, and at the tail end of a month as chaotic as January 2022, it's important to reflect on the progress that we have made against the odds, thanks to the advocates and communities across the country who are joining us today. So wherever you're joining from, please take a moment to appreciate yourselves and your fellow advocates. If you'd like, feel free to chime in through the chat to share an advocacy win, big or small, that you'd like to lift up for the group. Thank you so much for your contributions to this movement. Now, I'm thrilled to recognize someone whose tireless advocacy to advance health equity have made an impact on millions of families in Texas and across the country. Dr. Laura Guerra Cardis. Laura was recognized by several of her peers for this award, and many of them are here at the conference. Faced with years of inaction on Medicaid expansion in her state, Laura spearheaded the Sick of It Texas campaign, which engaged more than 5,000 grassroots advocates in less than 2 years to pressure their lawmakers to finally take action on healthcare. And these efforts pressure lawmakers to make progress on key health priorities in 2021, including reducing red tape for children enrolled in Medicaid and extending postpartum Medicaid coverage. In addition to her advocacy in Texas, Laura has been a fearless leader in the national fight to close the Medicaid coverage gap through her role on the Southerners for Medicaid Expansion Coalition. Her efforts to bring attention to the lived experience of the millions of individuals who are trapped in the coverage gap, most of whom are people of color living in the South, have been central to keeping this issue alive and Build Back Better negotiations. But the impact that Laura has made on the health justice movement is more evident in reading the words of her peers who nominated her for this award. Here are just a couple of examples. Mia Ibarra from Every Texan wrote, "Laura is always focused on our goal and on the people we aim to serve. Despite an often challenging political landscape, she identifies and pursues what's possible at every moment to move the work forward, even when she's tired and especially in the face of setbacks." Tracy Anderson, Laura's former colleague at Children's Defense Fund Texas, wrote, "Laura is one of the most tireless, positive, persistent, and hardest working advocates I have ever known. She sets her sights on goals that seem impossible, never gives up in the face of setbacks, and comes at problems creatively, circling and testing until she finds a path to success. She brings out the best in all those working around her and lifts up those who do good work while seeking no recognition or glory for herself. But she deserves so much recognition because the work she does and the things she has accomplished have been pivotal in improving the lives of low-income Texas families. Now, it is my honor to enthusiastically present this year's award to Dr. Laura Guerra Cardis.
Hi, thank you so much, Lauren. It is wonderful to be here with everybody today, and I'm really so honored and blessed to receive this award. Today, I'm a 15-year health policy veteran, but many of you may not know that my career began at Baylor College of Medicine when I earned my medical degree. While I loved learning about the science of disease and the human body, what has stayed with me the most are the stories and the lives of our patients. I was constantly struck by times when medicine could only provide Band-Aid solutions for problems with much deeper roots, like poverty and racial injustice. There are two patients whose lives have most stuck with me over the years. One was an enormously loving brother who slept every night on the floor of his sister's hospital room. She had had her 4 limbs amputated because of uncontrolled diabetes. They were very poor. She did not have health insurance and lacked the resources needed to manage this common chronic illness. We all listened to her cry every night as she adjusted to the new reality of losing her last limb. The second patient was of a beautiful 19-year-old boy who would go in and out of the hospital with seizures about every 2 weeks because without insurance, he was not able to get regular dialysis for renal failure. His illness could have been prevented with a simple wellness checkup when he was young. These stories, these realities are why we do what we do every day. They are what propel us to keep on fighting, to not give up until every human being is given the dignity of quality, comprehensive healthcare coverage. So after medical school, I decided to take the less beaten path and turn to health policy. I was quite proud when I got my first job as the policy director for the Children's Defense Fund of Texas. I was ready to do some good. Quickly, however, I truly questioned what I could possibly bring to a space already filled with so many brilliant and seasoned health policy advocates. I remember one particularly doubtful day. What kept me going was a poem by Marion Wright Edelman. Lord, I cannot preach like Martin Luther King Jr. or turn a poetic phrase like Maya Angelou, but I care and I am willing to serve. Well, I cared and I was willing to serve, and I decided that was enough for the moment. My admiration for my fellow health advocates, you should know, continues to this day and is the reason why this award means so much to me. I can think of no greater praise than the support of my incredible colleagues. Now, 15 years later, as I reflect on this moment, I have 3 lessons I would like to share with you. 1, each of us is unique and valuable. All of our contributions are important, and when we work together and align our talents, efforts, and resources, we are a powerful force. Never underestimate what we can do when we work together. 2, we do win, so don't forget that, but when we lose, we often take solace in knowing that the pendulum swings both ways. What I know is that the pendulum doesn't just swing back our way. It is not something we ride on passively. When we are down, we don't just sit, we organize. We build power and we pull the pendulum back towards justice. It is helpful for all of us, including funders, to look at losses differently, to see them as the power-building, innovative opportunities that they are. And third, what has most served me in my career is the belief that this work requires constant little acts of courage. The times when you have an idea but feel embarrassed to say it out loud. The times when you can see something that needs to be done but think you can't be right because no one else is talking about it or seeing it. These are the moments to speak. These are the moments when this movement needs your leadership the most. Before I close, I want to thank all the health equity partners across this nation, especially those from expansion states, for joining in our insistence that no one should be denied basic life-saving access to healthcare coverage in this country. Our nation's tragic Medicaid coverage gap exists because our healthcare system was designed to be structurally racist, to allow states to deny coverage to some. The gap exists because our gerrymandered, voter-suppressed states are structurally built to silence the will of the people. Continue to help us dismantle this fundamentally unjust system in our healthcare and in our country. We will need your partnership moving forward to succeed, and I look forward to continuing to partner with you. So thank you again for this deeply meaningful award. Go forth, be bold, and remember, this movement needs your leadership. Thank you.
Well, thank you so much for your leadership, Dr. Laura Guerra-Cardis, and you are so right that we can't underestimate what we can accomplish together. And I hope the folks joining today are getting some courage from your remarks. So thank you. With that, it's my pleasure to introduce our next speaker, Texas Congressman Lloyd Doggett. Representative Doggett serves as the chairman of the House Subcommittee on the House Ways and Means Committee. He's been a steadfast leader on legislative efforts to preserve seniors' access to care, defend reproductive rights, lower the cost of prescription drugs, and so much more. The health advocacy community is lucky to have such a strong champion for health equity. Without further ado, I am pleased to introduce Representative Lloyd Doggett.
Lloyd Doggett here from deep in the heart of Texas with heartfelt thanks. With your help, we have had some major accomplishments in the very difficult year of 2021. Approval of the American Rescue Plan, the biggest expansion of the Affordable Care Act since its inception, a long overdue ban on surprise medical bills, and some improvements in state Medicaid coverage. Thanks to all of you for the work you did not only last year, but in many years prior to that in planning and organizing for this historic moment. Your work has helped us in the House in securing approval of the Build Back Better Act. That includes my number one priority, which is to provide access to a family physician and essential medicines, comprehensive health care to 6 million Texans, 6 million Americans, including 2 million Texans, who've been left out and left behind when their states refused to take advantage of federal dollars to expand Medicaid. We now have them included in the marketplace. I join, of course, in a special salute to my longtime friend, Dr. Laura Guerra Cartas, with the Texas Children's Defense Fund. She has been an able advocate for so many important healthcare issues, especially expansion of Medicaid coverage. Congratulations, Laura, to you on a well-deserved Health Justice Advocate of the Year award. Of course, our struggle for healthcare justice continues. The unrelenting wall of obstruction from every Senate Republican, joined by 2 Democrats who refuse to breach that wall, is deeply troubling. I just think we have to be equally unrelenting in our advocacy for the Build Back Better investments in families and healthcare access and affordability and in reducing disparities. This legislation already embodies many disappointments. Certainly I have some, such as the exclusion of any meaningful immigration reform. And I'm sure what ultimately comes out of this Congress will not fulfill our hopes nor our needs, but we must secure all of the progress we can achieve when we can achieve it. And I'm hopeful that legislatively we'll make some progress and that we'll be able to also get some executive action to supplement that progress. Our mission is to ensure that we get a little representation for those with the greatest needs in a city where those with the greatest pocketbooks too often rule, those who have their own agenda with their limousine lobbyists and have the most access. And as we fight for Build Back Better, we also work to advance other critical health priorities that have already been omitted in the House, such as Medicare dental and vision coverage that I was sponsoring, stopping the outrageous 2-year wait for Medicare coverage for those with disabilities, and overcoming the grip of Big Pharma, which is so strong on this Congress. I extend my admiration and my gratitude to you. It is a privilege to partner with families, with all of you as our work continues, because we must never give in and never give up. Thank you.
Thank you, Congressman Doggett, for your tireless work to improve healthcare for Texans. You go beyond supporting healthcare, you prioritize it, and that means everything to a room full of advocates like us. Speaking of little moments of courage, I would like to now transition to introducing a personal hero of mine who is quite practiced at those acts of courage I mentioned earlier. Senator Warnock has had the courage to say to his colleagues that this country cannot move forward again while leaving more than 2 million low-income people, most of whom are in communities of color, without access to healthcare. We must close the Medicaid coverage gap because it is a human rights issue and because it is a foundational matter of economic, health, and racial justice. Me and hundreds of health equity advocates across this country thank you for continuing to stand firm in your resolve to close the Medicaid coverage gap. We will continue to stand firm with you in our shared commitment to ensure access to healthcare coverage for all people. Senator Warnock.
Well, greetings to the Families USA Annual Health Action Conference. Thank you so very much for allowing me to be here with you. First, I want to recognize two inspiring advocates for health justice. Thank you, Laura Guerra Cardis, for doing the hard work of fighting for Medicaid expansion all across our country. And to fellow Georgian Jenny Castillo, your dedication to educating and building trust with marginalized communities to get every Georgian vaccinated in the midst of this pandemic is inspiring, and it is proof positive of the American spirit. Long before the people of Georgia voted to make me their first Black senator, I had another title, the same as you, advocate and citizen. I've been on the front lines, urging leaders to close the coverage gap in non-expansion states for a long time. I believe deeply in the words of Dr. King when he said that of all the injustices, inequality in healthcare is the most shocking and the most inhumane. That's why in 2017, I came to the Capitol not as a senator, but as a citizen. I was arrested right down the hall from where my office now sits, protesting an immoral budget which would have taken away health care away from the most vulnerable among us. And at that time, I urged us by saying that America is better than this. And by using our collective voice, we proved that indeed we are. That's why I am so proud of the work we're doing right now to try to close the Medicaid coverage gap, to provide free and affordable health care for 4 million Americans, including the more than 640,000 Georgians who are in the coverage gap. Know that I am dedicated to putting this across the finish line. Additionally, I've been working hard to bridge the healthcare gaps many mothers across the country face. We've been putting forward legislation like the Kira Johnson Act, which directly addresses the maternal mortality crisis confronting women of color. And we've been working across the aisle with Florida Senator Marco Rubio to introduce the Improving Coordination for Healthy Moms Act and the Maternal Health Quality Improvement Act, which will bolster the federal government's response to the maternal health crisis. I've also authored the Capping Prescription Costs Act, which will help families and individuals save money on their medications. I believe that healthcare is a human right. So know that when it comes to working to protect and expand access to affordable, quality healthcare, you will always have a champion in me. Thank you so much for the work that you do. Keep the good fight going. Keep getting in good trouble. Keep the faith and keep looking up.
Well, thank you, Senator Warnock. We are so grateful for your efforts to prioritize health for families in Georgia and nationwide. And your reflections on your efforts to address the coverage gap as an advocate and citizen are the perfect motivation for us to keep fighting for health justice. To all of you joining us today, thank you for continuing to push for a just and equitable healthcare system. Now, before we sign off, let's take a quick look at what our visual note taker has captured from today's general sessions. Wow, that is very impressive and a wonderful depiction of today's discussion. So if folks want to take a look at that later, it will be uploaded to the platform. So keep an eye out for that. Before we leave, just a reminder to please rate this session through the Take Survey icon near the chat box. And we look forward to more exciting sessions tomorrow. We'll get started again at 1 Eastern, but feel free to log in early to explore the virtual platform and plan for your day. And you won't want to log off before a closing session featuring a fireside chat with HHS Secretary Javier Becerra. So have a great night, and we'll see you all again at 1 p.m. Eastern tomorrow for the second day of the conference. Thanks so much.